Well, good evening and welcome to the COVID-19 pandemic update. I'm Kayode Okikilu. First, the highlights. Lagos State Government launches mental health helpline for patients affected by COVID-19. And Edo State Government warns there are only 2 weeks left in current vaccination phase, urges residents to take the jab. And India records highest number of COVID-19 cases and deaths in 24 hours, with New Delhi marking 1 death every 4 minutes. Is this the quiet before another storm, or should I say another wave? Well, health experts certainly believe so, as they continue to warn of a third wave of the COVID-19 pandemic. The 81 new cases recorded in the past 24 hours certainly does not look alarming. But you know what they say, once bitten, twice shy. The cases also seemed to dwindle just before the second wave late last year, which is why the Presidential Steering Committee, while admitting that pandemic fatigue is setting in, is encouraging Nigerians not to be tired of the non-pharmaceutical measures of wearing a face mask, maintaining safe distance, washing of the hands, the use of hand sanitizers, and more. Nigeria has come a long way with over 164,000 cases, of which 2,063 people have been lost to the virus. 93% of those infected have recovered, while 7,909 are still active.
Nigeria has recorded 81 new COVID-19 infections in 11 states across the country. The new cases were reported from Lagos, the epicenter of the disease, with 26 cases, followed by Enugu and Ogun, with 13 and 8 cases. Rivers and Kano recorded 6 cases, while Kaduna and Plateau had a record of 5 cases. Akwa Ibom recorded 4, Delta and the FCT recorded 3 each, while Edo had 2 infections. The new figure has raised the total number of infections in the country to 164,993. Recently, the number of deaths recorded from the virus has declined, with only 2 deaths recorded in about 2 weeks. Again, no new death was recorded in the last 24 hours, leaving the total fatality toll at 2,063. 9 persons have been discharged after testing negative to the virus, bringing the total number of recoveries to 155,021. Almost 60% of Nigeria's target population have now been vaccinated, with Lagos leading after vaccinating more than half of its target population. According to the Africa Center for Disease Control and Prevention, 16 African countries have reported not more than 10,000 cases, and 29 African countries have a record of not more than 100,000 cases. While 7 African countries, including Nigeria, have recorded not more than 500,000 cases, South Africa and Morocco are the 2 African countries with a record of more than 500,000 cases. With a major spike in its infection rate over the past weeks, India has now become the 4th country to surpass the 200,000 death toll mark, after the US, Brazil, and Mexico, according to the US-based Johns Hopkins University. Globally, more than 149 million cases and over 3 million deaths have been reported across several countries.
The Lagos State Government has launched a mental health lifeline, which is a center to monitor mental health disorder, especially for those who have recovered from the COVID-19 disease. The State Commissioner for Health, Professor Akin Bayomi, says those who have had COVID-19 will be monitored closely to ensure they do not have long-term reactions to the virus. Meanwhile, as health experts continue to warn of an impending third wave of the virus, Professor Bayomi is confident that the state is well prepared to manage a third wave, but appeals to residents to continue to obey all safety protocols to win the battle against COVID-19.
During the COVID era, we've seen a lot of scenarios where people are reacting because they feel helpless and they feel that the stress is overburdening them. There's loss of livelihood, there's fear in the community, people are dying, there's uncertainty. So those are the kinds of issues that generate anxiety. And we certainly saw a lot of people during COVID who are presenting with severe anxiety disorders, imagining that they had COVID when in fact there's nothing wrong with them except the perception of what could be wrong with them if they contracted COVID. And even with this helpline, it's helping us to understand what kind of disorders are out there and where we need to focus our attention. We don't really know the long-term consequences of COVID or the vaccine, so we are certainly keeping an eye on people who've had COVID. We follow them up. Those that have problems, they can access us through EcoTelemed. They can come to one of our facilities at IDH or Nikon and tell us, if they're experiencing long-term consequences of COVID. When we look at the international literature, there's some data that we're picking up, and they say even up to a third of people who've recovered from COVID have certain problems that follow them long term. So we're trying to understand what that phenomenon is and whether there's something we need to do about it. We're keeping our guard up. Even if we get a third wave, we're preparing, and we hope that if we see something, it will be a small spike, but we're very prepared for a third wave, and if it comes, we will address it as aggressively as we addressed the second and the first wave.
Well, elsewhere, the Edo State Director of Disease Control, Dr. Bruce Osa, says the COVID-19 vaccination exercise in the state is currently at 85%, and time is running out for residents to receive their first dose of the AstraZeneca vaccine, which will expire in 2 weeks. But Dr. Osa, who was speaking to Channels Television in Benin City, the Edo State capital, also disclosed that the state COVID-19 task force is focusing more on advocacy rather than enforcement of the established COVID-19 protocols.
The chairman of the Edo State Task Force on COVID-19, Mr. Philip Shaibu, leads a strong enforcement team to the King Square axis of Benin City, the state capital, on January 18, 2021. The mission is to curtail the second wave of the pandemic by enforcing COVID-19 protocols, particularly the wearing of face masks. Today, the circumstances are different. Majority of residents move around freely without face masks. Business is not looking up for the face masks dealers, except those selling close to public places where the COVID-19 protocols are enforced. But the state government maintains that enforcement is still very much in effect. A member of the COVID-19 task force, Dr. Bruce Osa, explains that the focus now is on advocacy.
It's not just arresting people, taking people to... Many people still don't believe that there's COVID-19. So that is what we are working on. We are not just static in our approach. We are changing our approach to this response so that we can get the maximum benefits.
On the ongoing vaccination exercise, Dr. Osa declares an 85% success rate so far. He warns that the AstraZeneca vaccines have an expiry date, which is fast approaching.
We have just a couple of weeks for us to mop up these vaccines because since the expiration date is in July, early July, we have to stop this first dose of this first phase of vaccine at least 6 weeks to the expiring date so that we can still make up with because it is giving at least 6 weeks interval. So we have like 2 weeks from today to mop up this vaccine.
The Edo State government is also urging residents to support its efforts in curtailing the second wave of the virus by ensuring compliance with COVID-19 protocols in place.
Well, as the world continues to mark the World Immunization Week, the WHO is leading the campaign by drawing the attention of leaders across the globe to the fact that COVID-19 has resulted in the suspension of 60 immunization campaigns in 50 countries, 23 of them for measles, with Nigeria being at a risk of an outbreak. Now, most of these immunizations concern children who incidentally are left out of the COVID-19 vaccination process. Well, to bring into the COVID-19 vaccine coverage, some vaccine manufacturers have begun trials for children as young as 6 months old. The question is, How will this work? Well, let's speak with Dr. Folashade Fadare. She's a pediatrician. It's great to have you on the program. Well, the WHO does not recommend vaccination of children below 16 years, even if they belong to a high-risk group. But clearly, that might change soon. And that's dependent on the outcome of these trials. So how will this work first?
Well, you know that there is need for trial. You need to be sure that children will not react adversely. Most of the time, most drugs, even vaccine, if you want to do trials, you avoid children and pregnant women from the trial. It is ethically wrong. You know, children, they are still growing. Most of the side effects of those vaccine you cannot see. So that is why for now, except some trials have shown that children are okay. But you know, when it comes to COVID vaccine, it could not follow the long trial because of the short time that they need to produce the vaccine. But as we stand, except we are clear that children will not have any adverse effect, for now, we are not saying yes to giving children the COVID vaccine.
You know, while we do not know yet just how children will react to those vaccines, we have seen, or at least you have seen, how children react or respond to COVID-19. So can you tell us just how do children respond to this virus? It's different from the way adults react. Am I right?
Children with COVID vaccine don't run the severe course. From my experience, during the contact tracing, especially during the first wave, many parents are positive. Their children could be exposed, may even be positive, but they don't run the severe form of the infection. And so when we look at the curve, most of the people that are affected, that come out with serious morbidity or even died, are the people that are old or that have comorbidity. And that is why we don't put much emphasis on children. Even when they are exposed, if you test them first day, by the second, third day, they are negative. So that's why focus is not on them. They tend to burn out the virus faster than the adults.
So in terms of dosage, if you could just give us an insight into how vaccine trials might work for children, will the dosage be reduced? What duration will they be monitored for? Just some insight, if you can.
Well, those are the things that the manufacturer of those vaccines will be looking into. As you know, even when I happen to be one of the Nigerian Stop Polio Virus campaigner, and we found out that we have people that will always say this virus with this vaccine you are bringing every time is likely to damage our children. But for some of the vaccine that have been used over the years, you can be sure and say, oh, for children, there is no problem. But for COVID vaccine, we cannot say, okay, we are giving 0.5 mil, we are reducing it to 0.25 for children. Those are things that we cannot say. But we know that when you are giving vaccine, you are targeting the at-risk population. And the at-risk population still remains the frontliners,
right,
people with comorbidity,
right,
older people. Even from during the pandemic, we know that those are the people that died.
Well, Doctor, as we wind down,
you cannot say anything. You can't say much.
Right. As we wind down, I'm imagining as a parent how difficult or tricky it will be to allow your children to go through such trial. That's going to be a very tricky hurdle to cross, isn't it?
Well, even for the COVID vaccine, it took just believing God that you will be okay. I remember when I was going for the vaccine, everybody was like, oh, Oga. I said, don't worry. Just be looking at me. As you are looking at me, if I'm okay, you will be okay. So you can imagine I'm adult. So for children, but if it is what will be okay for them, if it is what will keep them safe and alive for us, we will expose them to it. But if they don't really need it, why do we give it to them? That is just the question to ask.
Well,
if
that's
they
a
need
big...
it, they should have it.
A big question there, Dr. Folashade Fadare. Thank you so much for sharing your thoughts with us on the COVID-19 update.
Thank you very much. Thank you for having me. Thanks.
Right. We'll go on a break, and when we return, we'll bring you more updates from outside the country as we speak with a general practitioner from the United Kingdom. Join us again. You're welcome back. The Africa Centers for Disease Control and Prevention is set to hold an emergency meeting with all ministers of health on the continent over the situation in India. The director of the CDC, Dr. John Nkegason, says Africa cannot be indifferent about what is going on in India, as it can happen anywhere, and the continent must work collectively to ensure that such scenario must not play out here. On the call for a ban on travel from India, Dr. Nkegason would rather African countries see the virus and not people as the enemy, while staying alert to ensure that the protocols on testing before travels are strictly adhered to. And while speaking during the weekly briefing, he also strongly advised against mass gatherings by political parties, religious organizations, social parties, groupings, and the rest. The emergency meeting of health ministers will be organized in partnership with the African Union and the AU Commission on Saturday, May the 8th. Well, let's bring you more COVID-19 updates, this time from Europe. Dr. Oluwatosin Taiwo is a general practitioner, and he joins us from Norfolk. It's great to have you on the program, but let me begin with what's playing out in India. I mean, I know you've been keeping your eyes on that as well as the rest of the world, but as a health expert, I mean, you see what's going on there, how health experts are handling the situation, how the system seems to be collapsing. Just how are you internalizing that?
Oh, sorry, David, I can't hear you.
Okay, I'll just go over that again. I'm wondering how you're internalizing what's going on in India. I mean, it's way different from what your reality is in the United Kingdom. I'm sure you've seen how the health system there seems to be collapsing, how there's lack of oxygen cylinders and the rest. So for you, how exactly are you internalizing it?
Thank you for having me, Kaidi. It depends. Do you mind repeating the question? I actually missed the first part there.
Okay, I'll do this one more time. It's pretty much simple. I'm just wondering how you're internalizing what's going on in India. I mean, the situation is dire. And for you, just when you look at news coming out from there, the death toll, how the system seems to be collapsing, what are your thoughts?
Mm-hmm. Yeah, that's a good question. Looking at the things now, we know it's a new strain that has come out there, a double mutation, and we are shocked, and I can say we are holding our breath to see what happens. Obviously, the uptake there and the maintenance of the social distancing rules has been a bit of not done properly, but we do not know how it's going to pan out. There's been some reports that some of the strains has gotten into the country. So we really do not know. We are going into a bit of an unknown in that area. But thankfully, some of the new data we are getting might show some promise. But I think we just need to get our hands together and try and help the Indian continent out.
Absolutely. We'll get into some of those figures that are coming out of the UK. But first, let's talk about the COVID-19 figures first, before the vaccine figures. I mean, the recent declines, do you think this is a calm before another wave?
That's what everybody is thinking. Obviously, once bitten, twice shy with the second wave, isn't it? But one thing that might slightly be different and work in our favor is the fact that there's a big uptake in the number of vaccinations that have happened so far, and with all the data that's coming out regarding transmission, showing that there's about a 50% decrease in transmission. We are hoping the third wave, if it does happen, will be nothing more than like an up spike itself. And hopefully we shouldn't go into full measured tier 3 lockdowns like before.
So you foresee a spike as opposed to a third wave. So let's talk about those vaccination figures now. The UK's Deputy Chief Medical Officer earlier revealed that vaccines can cut household transmissions way more than what we had before. In fact, after one dose, the AstraZeneca was showing 21 to 52%. We saw the Pfizer also 38 to 58%. So for you, does this finally answer that question on whether vaccines can stop transmission? Because I know that has been a huge question for people.
It it has been a huge question. And yes, to an extent, although it's preliminary in data that's coming out, it does tie in with what the CDC released sometime last week as well, with the Moderna and the Pfizer vaccine reducing transmission rates. So we think and we believe that with more data coming out, this will be the case. I mean, that was what was expected anyway, because it sheds the viral loading and reduces what we call it reduces the load itself from shedding when people spread it in infected people.
So, I mean, we've talked about the infection rates, vaccination, but let's talk about testing. I know that there's lateral flow tests, which, I mean, people have access to just to see whether you have the virus or not. But there are questions about how effective, how sensitive it is. So, do you think that, I mean, the lateral flow test has been quite effective in keeping tabs on, you know, the figures?
That's interesting that you mentioned that. Now, initially, when we started getting a lot of it out sometime in January, we were happy with it because we were using it for more symptomatic patients. And the data then showed that it was at least 95% effective in picking up COVID-19 infections. But that was for symptomatic patients, people that had the symptoms of COVID-19. There is a bit of concern now, especially like there's a body called the MHRA, the Medicines and Health Regulation Agency. They've expressed a bit of concern with the fact that we're going to be testing the mass population. We think and we believe, because of previous studies that were done, that this will reduce the efficacy down to as low as 50%. These are still thoughts. We do not know for sure, but it's for something that's going to cost a multi-billion-pound project. Personally, I believe, I do not think it's really necessary, to be very honest with you. And I think that's something for more discussion amongst my colleagues.
Let me just wind down by asking you, I know you're also involved in lifestyle medicine and the rest. So what are the trends really that you see post-COVID, or do I say even during COVID, because for some people they don't see post-COVID, but what are those lifestyle changes that you see will be the trends in coming days?
It's interesting you put it that way. Well, post-COVID, are you referring? Are you referring to post-COVID infection or after the pandemic has gone?
I'm not sure there will ever be that time, but we look forward to that. So let me just say after the pandemic has gone.
Well, I'm hoping a lot of people will change their lifestyle, because clearly what we see here, that the main driver of the infections are things like being overweight, comorbidities like diabetes, obesity, and these are all lifestyle diseases that I dare say that we've picked up and put on ourselves. So people will be making those particular changes. I do not know how it's going to affect our social well-being, the effect of community and hanging out together and gathering as a community, because that takes a big toll on the mental health aspect itself. So going forward after the pandemic, I'm hoping that we may be able to build better lifestyle choices.
Well, Dr. Tosin Taiwo, it's been a pleasure speaking with you on the program tonight.
Thank you very much for having me, Kevin. You take care.
I will. Well, the United States has joined the list of countries warning its citizens against traveling to India as the country continues to battle a devastating coronavirus wave. The number of cases of the country topped 18 million today, while the death toll continues to surpass 200,000.
India's coronavirus cases continue to overwhelm the country's health sector, with doctors and patients lamenting about inadequacy in handling the dire situation.
At this point of time, we have patients, we are beyond our capacity in the ICU, as you can see. We have put in beds and stretchers between beds. We have run out of ventilators. We are using anesthesia machines to ventilate patients. We have young patients now. We have triaged patients. In spite of that, we are running out of ventilators. We have patients on the wards who are very sick, who ideally should be in an ICU, but we have no space for them.
The rising death toll means grave diggers have been working round the clock to bury victims. The country reported 379,257 new infections and 3,645 new deaths. It's the highest number of fatalities in a single day since the start of the pandemic. The world's second most populous nation is in deep crisis. Hospitals in the country's financial center of Mumbai are cramped with patients and is facing a daunting shortage of hospital beds. The biggest field hospital in Mumbai has 2,300 beds, among which are 800 beds with oxygen support systems and 120 intensive care unit slots. However, doctors say all hospital beds are now occupied amid the soaring COVID-19 cases. Even here, grave diggers have been working just as hard because of the rising death toll. Mass cremations are becoming a common sight as well, with about 30 to 40 taking place every day. Meanwhile, more help has been arriving. Today, a shipment containing 120 oxygen concentrates arrived in New Delhi from Britain. It is the second shipment to arrive in the country from Britain, and even from local Sikh groups.
Well, don't forget to protect yourself. The virus is still out there, so continue to take responsibility. And visit our website, channelstv.com, for more information and updates and a better understanding of the pandemic in general. We also have all the big stories from politics to business, sports, and so much more. Well, that's the COVID-19 update. Thank you for watching. I'm Kayode Okikelu.